So we're going to talk about Rennie and Klein case about right to refuse medication. A lot of times in inpatient facility, you'll have a patient who is admitted to the inpatient unit and they're very psychotic, but they have the right to refuse medication. So this concept of and case talks about that. So this talks about patient rights in psychiatric treatment. In this case, John Rennie was a former pilot. He was diagnosed with paranoid schizophrenia and multiple hospitalizations due to aggressive behaviors. And he was given prolixin without his consent, and the case was filed. The key is that right to refuse medications in involuntary patients. So IVC patients or involuntary commitment patients can refuse medications. So the federal court recognized that patient has the right to refuse medications, and patients can decline medication unless they're deemed incompetent or in emergencies. Sometimes we do non-emergency forced medications where two physicians have to consult in North Carolina to give the medication. So each state may have different regulations of this. You want to know your state's regulations, but you know that you want to know that a patient who is involuntary committed can refuse medications. So, um, there is, you have independent psychiatrists will review this. So there is a legal precedent which is set that IVC patient can refuse medications, and you have to follow a process to be able to give them medications based on the state. Thank you.